Noah Gochanour loves to play on the playground, just like most 8-year-olds. But about a year ago, he started complaining about pain that wouldn't go away.
Just very sporadically, he'd say, "Ow, my shoulder hurts." Well, at first I just thought, he's hurting himself. Quit launching off furniture and your shoulder won't hurt.
My arm stopped working. I barely could lift it. Tried putting on 2 shirts and it didn't work. So Mom took me in.
He had a visible mass that you could see looking at his back.
Beaumont Children's Hospital doctors evaluated Noah and discovered the reason for that pain and discomfort.
They found out there was a tumor.
She said, "Sarah, Noah has Ewing sarcoma. I need you to breathe," because she knows me well. And then she started talking about other stuff, but I didn't hear any of it. It kind of was the scariest moment of my life.
It is the second most common primary bone tumor that we see in pediatrics. All cancer in children is rare. The bone tumors are particularly unusual.
The American Cancer Society says about 1% of all childhood tumors are Ewing tumors. Doctors diagnose 225 children and teens with Ewing tumors in North America every year. A Ewing tumor in the shoulder blade is especially rare. So Dr. Kate Gowans met with the family and mapped out a treatment plan.
It helped because I didn't have to do a lot of the thinking at the moment because I was a mess. I didn't know which way to turn or what to do what's Ewing sarcoma? I never heard of anything like that.
It requires a lot of therapy and very intense chemotherapy over almost a year's time.
We were all mad and sad because I had cancer.
Hey, how you doing? What's going on, big guy?
Because the cancer was so aggressive, Dr. Kimberly Less removed Noah's shoulder blade.
It was a bit of a shock. I didn't even know you could do something like that.
Most people say, well, how can I function without a shoulder blade? Fortunately, especially in young kids, they can adapt very well. He still has full use of his hand, his wrist, and his elbow.
Chemo continued after the surgery, every other week. The treatments can make patients feel ill. Noah never flinched. Through it all, his family was by his side, including his new baby sister.
The kid hangs out on the inpatient side, plays Nintendo, Xbox, whatever he plays up there, does fine, runs around, feels good.
He's a very vigorous young man. He's got a great family support. So really, once he returns back to school in the fall, if you watch him walk down the hallway or do his activities, you would never know he's missing a shoulder blade.
It's why we all love what we do, and it's why I love to work with kids. They are tough, they're resilient, they're fun, they're funny. You can tell when they don't feel good. All they want to do is play.
He's had an amazing set of doctors working with him, and they've been with me every step of the way.
A series of tests confirm Noah is now disease-free and ready to trade all those days in the hospital for a lifetime of happy memories.
When you're done with cancer and your hair starts to grow back, you can ride your bike.
My 8-year-old boy is much stronger than I am. He is resilient and amazing.